Hey guys, it's Hina Sheth here at Rebalance Physical Therapy and Wellness, and today I want to focus this video around male pelvic pain, what it is, who fits in that category, what kind of symptoms that you might be feeling, and what is it that we basically do for this. Now, male pelvic pain is one of these things that not many people understand. What we often see here at Rebalance when we have a lot of men come in is that I went to my urologist, I went to my colorectal doctor, I've been to my gastroenterologist, and I've even seen, a number of other wellness practitioners, and no one seems to be understanding why I'm having this condition. And so that's kind of what we hear. And so what I'm going to start with is when we talk about male pelvic pain, where is it in the body? And then, like I said, what does it entail and what we're going to do about it? So I'm going to show you a lot of pictures today. Some of you guys who already know a lot of this, I have to simplify this video for some people that don't even understand anatomy, and for some of you guys that totally understand anatomy, but you're really just wanting to know what we're going to do for you. But sorry, guys, you got to kind of sit through the whole thing unless you want to fast forward through the video. So this is a model of the human skeleton, okay? This right here, all right where I'm circling my fingers, and this is the back of the skeleton, right where I'm circling my fingers, okay, is basically the pelvis. So when we talk about pelvic pain, it's usually somewhere around here, and it incorporates not only the bones, but the muscles that go on top and all the organs that go inside, okay? So this is the region that we're talking about. And all the musculature that can be involved in this area. Oftentimes when we treat here at Rebalance, we're treating the whole person. So, but for the sake of this video, I just want to show you some of the main muscles around the pelvis. So if we kind of start layering muscles on top of that skeleton in the pelvis, okay, here's the pelvis again. There's the pubic bone in the front. Right around here, okay, all of this is all the musculature deep on the deeper layers that you typically don't see, or think about when you're thinking about regular muscles around the pelvis, okay? So there's a lot of muscles that cross from the spine into the pelvis, down into the hips, okay? So that's the front. And then in the back, you also have a musculature there, and this shows you some of the big muscles, the glute muscles that most of you guys have heard about. But then there's a bunch of other deeper muscles. If you take this and cut it out, there's a bunch of other deeper muscles in through there too. Now, if we layer back through the front, we kind of showed you the deeper musculature, but in the front, most of you guys have heard of these muscles. These are abdominals, some of your quad muscles that go on top, okay? But this layers on top of that other deeper musculature. So again, pelvic pain can involve any of that. But if we even look deeper, okay, and we, again, think about more organ-related stuff, okay, you are going to find that there's another layer of musculature deep inside the pelvis, and I'm going to talk about the organs in a second. Right here, this is called your pelvic floor musculature. So this is deep inside of this pelvis. So inside here, if you can kind of look down through there, that's what we're looking at in this picture. And this is the muscles of the pelvic floor. Now, these muscles can start to get involved for many different reasons. It can involve structural issues because your alignment is off. It can be because certain muscles aren't coordinated and working right. And so then these muscles get involved. So this is just another muscle layer, just like any of the other musculature that I've showed you. It's just, this is so deep inside the body that you typically can't see this from the outside. Well, you're not going to see this from the outside, but you typically can't feel most of the musculature from the outside. And so the only real way to assess it is by an internal exam, which we'll talk about in a little bit. But if you think about other structures that lie in this area in the pelvis, okay, outside of just the bones, the muscles, as well as ligaments and things like that. We're also looking now here at a cross section. Okay, this is if you split the body in half from the side. These are all the organs, the main organs that sit inside the pelvis, okay? So for the male, you've got your rectum, you've got the bladder, you've got your prostate, and you've got, all the other sexual organs down here, which on here you can't see the scrotum and the testicles and all that kind of stuff. Well, maybe you can. All right. So basically, any issues in this area, including symptoms that you potentially have in the rectum, the bladder, feels like it's the prostate, the penis, the scrotum, the testicles, any of the musculature or in the joints like the groin, the lower abdominals, the gluteals, the hips, all of that in the world of male pelvic pain, that's what it all encompasses. So there's a lot of different things that can happen when you think about male pelvic pain. Okay, and symptoms can be anything, like I said, from a musculoskeletal origin to an organ-related organ. So what are some of the symptoms that males have? And I'm just gonna go through some of them, but we have a complete list at the bottom of this. But, things, like I said, scrotal pain, testicular pain, penile pain, pain with ejaculation, pain after having a bowel movement, feeling like you have heaviness or a golf ball in your rectum. Like I said, lower abdominal pain, feeling like you have a hernia, but no one's been able to find one. Feeling like there's something wrong with the prostate, or you have an inflammation of the prostate, or maybe you were told you had a prostatitis, but it's not really a prostatitis because they've done all the lab workup and they haven't been able to find anything. Sometimes it can feel like a urinary tract infection, but again, lab work shows that you don't have it. Groin pain, such as even sports hernias and even like pubic symphysis pain. Some of you guys may have heard of this term, sacroiliac joint pain. Maybe pain with sitting that you feel. Pain that feels like it's a hemorrhoid, but again, you've seen your colorectal doctor and it's not really a hemorrhoid. So again, these are just some of the things that you feel. And again, more organ-related structures could also be difficulty having a bowel movement, urinary retention, feeling like you have to go to the bathroom all the time, feeling like you're waking up in the middle of the night and feeling like you have to urinate all the time. And this is an absence of a prostate issue, a specific prostate issue, like your prostate is getting enlarged. Okay, so if you've had a urologist, you followed up with one and you find like, hey, your prostate is actually fine, but you're having these symptoms, then chances are this is a musculoskeletal issue, meaning that either the muscles, the bones, and a lot of other structures in the area are getting involved that someone like us can actually help with because it's involving a lot of the musculature. So what do I mean by that? And let me see if I can clarify a little bit. And I'm sure some of you guys have seen some of our other videos. So basically, what can happen, let me grab my pictures here. If I can grab more. What can happen here is the body can basically form lots of different, and for different reasons, okay? Why do you have pelvic pain? There could be a million different reasons. And actually, I should probably go through some of those. So why does somebody get this? It could be anything from sports injuries. It can come on all of a sudden. It can come on very gradually. It can happen in runners and bikers and people that are sedentary and sit a lot. It can happen in, teenagers. It can happen in little kids. It can happen all the way until you're 70. Again, for lots of various reasons: falls, trauma, surgery, stress, weird, just all sorts of weird injuries that you may have had that maybe started in one place, but they feel like they've kind of like worked their way up or worked their way down. So there could be a lot of different reasons why you develop this. And the reasons why this happens is because your body compensates really, really well. So again, I told you these pelvic floor muscles are just like any other muscle. So they can start to overwork or underwork or a combination of the two to compensate for other issues in coordination in the body or other injuries that have happened either local or outside of that area, okay? So we see that a lot. So basically when that happens and what's going on is that muscles in and around the pelvis, and they start to develop knots, and they can come knots in specific areas of the muscle, and you can have them in many different muscles all at the same time. They develop knots, and when that knot has formed, okay, you don't have good blood flow going through that area of the musculature. And if you don't have good blood flow, it's kind of like you're cutting off nutrient into that muscle, because now there's not good blood flow, there's not good oxygenation, that muscle can't repair, it can't function right. So that can set up like an irritation and pain within that area. And that's this knot that becomes painful is known as a trigger point. So I have a quick photo here, and many of you guys have probably experienced, a trigger point right here in your upper trap, where if you feel it, you feel like, oh, there's a knot there, but it feels good if I kind of press on it. Sometimes you may press that and you're like, oh, that's so painful. That's typically a trigger point. And so what you see is that, if this is part of the muscle, part of that muscle, it doesn't have to be the whole entire muscle, but part of that muscle, if you kind of zoom in on it, you can get these little trigger points in here. And when you get those trigger points, that is what can become painful within the muscle. And those trigger points can then actually give you localized pain, or it can actually refer pain to other areas. Here is a trigger point that, is in the glute muscle. So you can have a tight trigger point in through here, and it can actually refer pain down all the way into the lower leg. Now you've got a ton of muscles in the body, hundreds and hundreds and hundreds of muscle, more than 600 muscles in the body. Each of those muscles can end up having trigger points. So you can imagine in and around this pelvis, you can definitely, because I showed you there's a lot of musculature in that area, you can develop trigger points in any of that musculature, including the pelvic floor. And when you start having trigger points in and around that area, they can start giving you all sorts of pain, all sorts of symptoms, especially those pelvic floor muscles can actually give you organ type pain. So this is where those muscles can actually start giving you symptoms of like pain in your bladder, pain in your prostate, scrotum, testicular, all the ones that I basically named before. And you can have a combination of all of these things. It's not unusual for men to come into our clinic and they actually tell us that they have 10 of these symptoms going on. It's not uncommon. And so, I'm making this very simple in the sense that I'm saying all of this is coming from musculature, but you have to also realize there's a lot of other tissue, including something called fascia. There's also nerves. There's lots of blood vessels and veins that go in through this area that can also be affected by tight musculature, okay? So I keep going back to the muscles because a lot of it that we see in our clinic revolves around muscle and fascia, and then they can influence a lot of the nerves and things like that in this area. Okay, so basically, that's kind of, why in a nutshell it happens, what kind of symptoms you might be experiencing, and kind of what's going on. So now how do we treat this here at Rebalance? So we kind of use a holistic approach. And what do I mean by that? Holistic is kind of just thrown around everywhere. Well, holistic means exactly what it means, is that you're looking at the whole person. What we have seen oftentimes is that men will go, again, many of you guys can relate to this. You went to your urologist, they don't really know what's going on. So they say, well, it's not your bladder, it's not your prostate, it's none of this. We're not really sure what's going on, and so they're specifically looking at that one area. Then you may go to your gastrointestinal doctors because maybe you also have some GI issues going on. And then they say, well, there's nothing really going on with your GI. Maybe you've got some IBS, but that's what you have. And then you may go to your colorectal doctor and complain about, hey, something feels off in the rectum. And they're like, yeah, you have some hemorrhoids. We can give you some meds for that, but I don't think that's what's really causing your pain. Then you may go, perhaps some of you have already gone to a physical therapist that treats stuff in this area. Or maybe you've gone to a general physical therapist because you are having hip pain and back pain. And so they're looking at your hip and your back. But what we do is we kind of look at all of these things together and say, how is this related to this, related to this, related to this? How is all of this working together? Because your body does not work on its own. It doesn't work in pieces. It works as a whole symphony, as a whole orchestra to make you function, okay? Kind of like an orchestra, it takes a whole orchestra to play a really beautiful piece, okay? So it's the same idea with the body. The body, including every single, nerve and muscle and bone and organ, they all work together. So when we are evaluating someone, we basically look at all of these things. So it's not unusual for us to want to find about your dietary history. It's not unusual for us to find about all of your other past history and traumas and surgeries and things like that. It's not unusual for us to ask you, hey, what's your digestion like? What is your bladder and your urinary pattern like? How is that? How did that affect your hip, or how does your hip affect that? Or when did your hip injury start and when did your bladder symptoms start? So we kind of look at all of this and create a really nice timeline and a nice picture to really figure out what's going on. And then that, along with our evaluation, which we're going to check sometimes everything from head to toe if necessary, but really honing in on the area that we really need to focus on to get your symptoms down, but then to kind of take a step back and look at the whole picture, again, the holistic picture, to see, hey, where else do we have to work? Because the body doesn't look like it's coordinating right either. And then when we start to treat you, we kind of have a sequencing of how these things need to be fixed. Sometimes it's an order of what's most important for you and what function you need to get back to. Sometimes it may be like, hey, I know you want to get back to these things, but we really got to treat this first in order for the second piece to work so that you can go back to what you want to do. And so every person is very individual, and I tell this to everyone that comes into our clinic. If I have 3 people with the same 3 symptoms, they will have 3 completely different plans of care depending on factors for the patient, what they want to get back to, what their lifestyle is, what their dietary influence is, what they do for a living, how much they take care of their kids. I mean, it could be a number of different factors to how their body type is. Are you skinny? Are you a little big boned? Do you have tight joints? Do you have really loose joints? What else is going on in your, what else is going on in your history? Sometimes we may even have to say, hey, does your mom have this? Did your dad have this? Do your kids have this? And that helps us put in a big picture. So as far as the specific treatments that we use, again, on our website, we have lots of different specifics on what we do, but honestly, we've got so many tools in our tool bag as far as what we do. Much of it is evidence-based, and some of it is not evidence-based, because honestly, pelvic pain and the treatment of pelvic pain through a physical therapy approach, it's not in its infancy as much anymore, but it's still relatively new, and we are still learning so much every single day. So sometimes things that we find that, hey, this actually worked for another client of ours, and sometimes our patients are our teachers. My patients have definitely taught me a lot. And so I take that and I use it as a tool to help treat some of my other clients, and that's not unusual. So it's a combination of evidence-based as well as clinically what we have found that works for a lot of our patients. A lot of our treatment initially is a lot of hands-on work, and then a lot of education on teaching you how you can empower yourself to improve these conditions. So, we're going to teach you all the things that are supportive to the treatment that we do during our session, and then how you can hopefully maintain a lot of it in between. And then, like I said, our goal is always to make progress from one session to the next. We have also aligned ourselves with a lot of other great, amazing wellness practitioners, as well as healthcare practitioners, medical practitioners that are, that also work with us to get a lot of conditions better. So I hope that's helpful to any of you who are wondering, hey, what's our approach to male pelvic pain? Is this a place that I actually want to go to? I've already had physical therapy, or maybe I haven't. Do they know what they're talking about? Hopefully I've convinced you of that. But so I hope that's helpful. If you need specific details, you can see in the body of the text below that will have lots of other detail on this video. And I hope to see you soon. Take care.